In this inspirational, I would like to share some details with you about a so-called positive straight leg raise or Lasègue test. Imagine you perform the straight leg raise test on the left side and you ask the patient, does that change anything? Does that have any influence on the patient's symptoms? And then the patient says, yes, it hurts. But don't automatically assume it hurts in the leg. It's quite possible that it hurts in the back. And then you ask, where? And then the patient says, well, I feel it in my back, the lower back on the right side. So you do a left straight leg raise and you produce back pain on the right side. Is that possible? Yes, it is. And that's what we call a crossed straight leg raise. And this is one of the typical elements that point in the direction of an internal derangement or disco-dural disco-radicular conflict. Another question. Does the straight leg raise always have to produce leg pain? The answer is no. Because the straight leg raise is not just a test for the nerve roots, but it's also a dural test. So it's perfectly possible that you perform the straight leg raise and you provoke back pain. A next question. Is it always necessary that, if we consider a straight leg raise being positive, that the straight leg raise is limited? No, of course not. It's quite possible you have end range pain on straight leg raise, and that happens a lot. Another nice detail is that you can find a kind of painful arc on straight leg raise, like we have a painful arc in the shoulder. And a painful arc on straight leg raise is also something beautiful. It's a beautiful clinical element that points again in the direction of some kind of internal derangement. And finally, imagine we perform a straight leg raise and then we go as far as we can. We ask to the patient, what do you feel now? Where do you feel it? And then at the end of the straight leg raise, we ask to the patient, okay, give me an accessory neck flexion. And we are all familiar with that. And the next question is again, okay, does that change anything? We all know that accessory neck flexion can provoke more pain. But did you also know that accessory neck flexion can also diminish the pain? That the patient feels better? Well, that's also typical for some kinds of internal derangement. So a straight leg raise is not just a straight leg raise. I refer to our online and live courses if you would like to find out more about clinical reasoning, diagnosis and therapy strategy regarding the lumbar spine. So see you for the next inspirational. Bye bye.